Joining us now to discuss all of this is the publisher of Convergence Rhode Island, an outstanding healthcare and innovation, if you will, oriented newsletter and website here in Rhode Island, Richard Asinof on the Seekonk Supply Hotline. Good afternoon, Richard.
Good afternoon, Bill.
Pleasure to have you on. So first, your take on where we're heading for October 1st and what that will do to the infrastructure of Rhode Island's healthcare systems.
Well, I think that despite a lot of the commentary, I think most of the healthcare workers will get vaccinated.
Yeah.
It's in their best interest that, Care New England expects to be at 100%. You reported that South County Health is going to be at 100%. I'm hearing that there's going to be additional pickup from within the nursing homes, that they're expecting that the number of people unvaccinated is going to decrease. Because simply the vaccines are effective, they work, they're safe, and it makes sense if you're in the midst of a contagious pandemic to protect the patients.
You know, what you say there, it seems like it's so obvious, yet there's this gap and it's driven by misinformation, maybe skepticism, maybe fear, which fear I can empathize with, but the misinformation, the sort of generic skepticism, how much of that do you think is impacting people who are not getting vaccinated versus actual medical or true religious reasons? In other words, are there people who are just trying to find an excuse to not get vaccinated of the remaining unvaccinated healthcare workers?
I can't speak to what's in their minds, but I can agree with you that misinformation is deadly across the board, and there's a tremendous amount of misinformation out there. I've listened sometimes to your show and when you're on for Dan and Dan's show, and people calling up and saying that they won't have that poison put into them, referring to the vaccines, and that's just false. It's not true. Or somehow that the Moderna vaccine is not a vaccine. It's false. It's not true. I talked with an associate dean of one of the nursing schools, and her feeling was that it might be what's needed is a change in messaging, of perhaps relying on nurses to deliver the message rather than doctors and experts.
That's
because
interesting.
People have a different relationship with nurses, and they're more trusting, and they don't come across in the same, we are the experts, but they have a different way of talking with patients. And that may be true. But in the meantime, I think it's a distraction in a lot of ways to the more serious issues that we confront with our healthcare system.
Yes, I completely agree with you on that, and I think that you put it precisely, that it's a distraction, and the larger issue is just the healthcare system itself. Now, you have a very interesting article that is in Convergence Rhode Island right now, where you ask the question, will $1.1 billion be enough to rescue Rhode Island? Well, will it be enough to rescue Rhode Island, and how should the American Rescue Plan dollars be utilized to bolster, reinvent, improve, and grow our healthcare infrastructure here in the state?
Well, that's a big question. I'm not sure that the way that we put out the largesse, this $1.1 billion, as if it's somehow going to rescue Rhode Island. And I think the needs are much greater. And we have to look at beyond, as I say in my article, $500 million is proposed by the housing advocates in terms of investments in affordable housing. Another $100 million is proposed by the people involved in providing care for the people who are disabled and have different types of problems because the salaries are so low for the workforce. And that's a huge issue, that if we don't increase the reimbursements that people get and the pay that people get, it's hard to maintain a workforce, because they'll take jobs in Connecticut or Massachusetts where the salaries are higher. They can go to McDonald's or Dunkin' Donuts and get a higher salary than they can as a CNA. in many cases. And so we have to prioritize what that means. I often say that healthcare is personal, it's complex, it's expensive, and it's sort of the center of most people's universe these days. You know,
Right.
I would love to see polling that looks at voters of what's the most important issue and where healthcare comes in and how that's broken down on the demographics around male versus female. Because my guess is that more people are concerned about healthcare than any other issue today.
That's fascinating, and a lot of what you said right there. At 4:17, it's Richard Asinof of Convergence, Rhode Island, joining us on the Seekonk Supply Hotline. Bill Bartholomew in for Dan here on WPRO. We're talking about the healthcare system as a whole. And, you know, as I said in the first hour of the show, look, the vaccine mandate and the loss of workforce is just one, really, frankly, small portion of the general healthcare conversation in terms of reinventing infrastructure. The other question, as you just brought up, is general compensation, quality of life for those who are in the field. When you look right now at Rhode Island, where we have the mega merger, so to speak, taking place, but we also have a diversity of organizations, whether you're talking about the Yale system that spills into Westerly Hospital or even some of the smaller independent ambulatory centers, we have a robust healthcare system. But where is the area the most growth is needed? Is it in the urban core where there's a lack of brick and mortar access, or is it something else that we're not looking at right now?
Well, it's a combination of things. I don't think it's a yes or no situation. The people who really are providing, I think, the backbone of the safety net in healthcare are not the big institutions. They're the community health centers.
Yeah.
They are the people who are dealing with people who are more, shall we say, living on the edge, who have higher demands of health care. And they are the providers. So when it came to COVID-19 and the response, they were the people on the ground who were really dealing with it. Much of the hospitals got to see the most serious patients and the people going into ICU care, but it was on the ground. It was the community health centers, whether it be Blackstone Valley or it be the Providence Community Health Centers. They were the people on the ground trying to prevent the contagion from spreading.
Right.
And I think they are the people who need more support in many ways to continue, because a lot of their work is around prevention. There's also excellent work being done by health-centric advisors in trying to develop digital products. They just won an award from the Providence Business News about how to connect patients to providers in a digital fashion, so you don't have to go into the office and you can monitor things like blood pressure on a regular basis.
Yeah, using Bluetooth technology, stethoscopes, so on and so forth. Richard, can you hang on for just a minute? We're going to check traffic.
Sure.
I'd love to come back and continue this discussion. It's outstanding. Richard Asinof of Convergence, Rhode Island, with us here on the Seekonk Supply Hotline on WPRO. Let's check traffic. Right back with Richard Asinof.
From the Kitchen and Countertop Center of New England Traffic Center, here's your WPRO traffic.
Crews are in the process of removing a disabled vehicle. We had 95 south at Thurber's Ave. We're still dealing with some road construction, not 195 east on the Braga Bridge. You are stop and go from Route 103. We've got an accident, 95 north at Atwells. That's going to have you backed up well past 195. 195 west, you're backed up to the Mass border. 95 south, we're seeing some heavy volume from Route 1 down to the 610 connector. You're all jammed up. 146 north between 99 and Sales Hill Road. Same goes for the southbound side between Mineral Spring Ave and 95. You're bumper to bumper, 24 north from exit 1 to exit 3, and the 610 connector inbound from Dean Street to 95 is stop and go. I'm John Laurenti with you right now traffic.
The Dan York Show.
This traffic report in the Dan York Show is sponsored by Atlantis Comfort Systems. Atlantis Comfort Systems, licensed service technicians, take care of making sure your home is warm and comfortable all season long. So contact Atlantis Service at 401-233-2600 or go online to atlantiscomfort.com today.
Stay connected. WPRO is here for you on all of your smart devices. Download the free WPRO app. Stream us online at 997WPRO.com or ask Alexa to play News Talk WPRO.
I'm Donna Soa Allard. certified financial planner professional, and co-host of the Money Talk radio show. At SOA Financial Group, our advisors have been offering investment advice for more than 30 years. We've learned that time in the market matters more than market timing. And having a plan designed around you will help you feel clear and confident with your money. If you've been sitting on the sidelines, waiting for the right time to put your money to work. If you're wondering, is now the time to retire and can I afford the life I want? If you're looking for a partner to walk with you as you make important financial decisions, SOA Financial Group can help. Call us at 401-434-8090 and find us online at soafinancial.com. That's SOWA financial.com.
Securities offered through Commonwealth Financial Network, member FINRA, SIPC, a registered investment advisor. Advisory services offered through SOA Financial Group are separate and unrelated to Commonwealth.
Vaccines are not enough. If you think vaccines alone will protect you from COVID-19, think again. Monitor regularly for fever, as it's the leading sign of COVID-19. Use Exergen, the only thermometer scientifically proven to detect fever. Protect yourself and your family with Exergen Temporal Scanner. Learn more at Exergen.com.
Exergen is changing the way the world takes temperature.
When a nasty cold keeps you up all night, Vicks NyQuil Severe gives you powerful relief from your worst cold and flu symptoms, which changes a night that sounds like this into a night that sounds more like this. Ah, that's better. NyQuil Severe. The nighttime sniffling, sneezing, coughing, sore throat, stuffy head, aching, fever, best sleep with a cold, medicine. Use as directed.
Listening to WPRO could pay off. Literally. Listen every hour from 8 a.m. to 5 p.m. for the national keyword. It's your chance to win $100 and a shot at $25,000. It's the $25,000 payoff on WPRO. Standard messaging and data rates apply, and please don't text and drive. Rules and info at 997WPRO.com. Sponsored locally by Muse Tavern. Great food, great atmosphere, and of course, 69 beers on tap. Muse Tavern, Wakefield. Now, back to Dan York.
At 4:24, it's Bill Bartholomew in for Dan this afternoon. We're speaking with Richard Asinof, publisher of Convergence Rhode Island, one of the state's leading news voices when it comes to all things healthcare related and innovation and a number of other topics. Speaking specifically to the 10-1 vaccine mandate that is approaching rapidly for healthcare workers here in Rhode Island, and generally to the state of the healthcare system in Rhode Island and what needs to be done. Richard, you have an outstanding article, Reinvention of Medicaid Continues to Evolve. How does that play into the discussion that we're having right now in terms of just rethinking and trying to navigate the healthcare system in Rhode Island based on what we've learned from COVID and just in general?
Well, I'm going to get a little into the weeds here. I'll see whether I can do it in my appropriate sound bites here.
Gotcha.
The reinvention of Medicaid was an effort to try and find cost savings within Medicaid to move towards away from fee-for-service and more for an alternative payment method. I'm not sure that it's worked. There is a lot of social engineering that's going on with it. The biggest problem is that the managed care organizations, which are insurance company, but they're essentially private entities, basically run Medicaid for the managed care organization patients, which represent about 1/3 of all Rhode Islanders. And currently they're served by United Healthcare, Tufts Healthcare, and Neighborhood Healthcare. There was an RFI that got put out this spring with a number of new potential entries into the marketplace, including Blue Cross and Blue Shield of Rhode Island, which is trying to get back into that market, as well as Molina Healthcare, which is a national company based in California. And it's sort of like musical chairs. You can't have 5 managed care organizations, and so some of them are going to get left out. So it actually is an opportunity to look at possibly doing an audit to see how effective the managed care organizations are, because they are one of the driving forces in terms of how Medicaid dollars are spent.
Yeah.
And there's no real, at this point, accountability around that. So I'm hearing from the people involved in providing the services a lot of unhappiness about that.
Yeah, that makes sense. And that's something that in general you've been, broadly speaking, in some of the press conferences you've been bringing up. And you know what's interesting, folks, because we used to hear these press conferences on a regular basis. They're obviously televised, and we air them here live on WPRO. You know, you were one of the reporters that, because I'd hear criticism from people, say, oh, they're reporters in Rhode Island, they don't do anything, they don't ask any tough questions. I mean, you had a number of questions that have stumped both governors in this particular area. We've got about 2 minutes before we're going to run to the news, and to wrap things up here, and first of all, I'd love to do a podcast on this topic where we can just go on endlessly and you can provide the information you've gathered through your reporting.
That would be great.
But just in sum right now, kind of going back to where we started, October 1st is coming. What should the average Rhode Islander know about the state of healthcare, especially for folks who are just tuning in right now? The state of healthcare with October 1st looming.
Okay. I would say trust the vaccine. It works. It's effective. If you can get vaccinated, get vaccinated. You're protecting yourself, your family, and your loved ones. I think a lot of the resistance to vaccine is based on misinformation. I think it's a distraction. Let me put out one bit of news that hasn't really been covered. There was a serious issue around the availability of Narcan. There was a shortage. There was even a die-in in front of EOHHS. And the Attorney General provided $1 million from a settlement with McKinsey, which had turbocharged the opioid epidemic on the behalf of Purdue Pharma. Well, I just heard that the Attorney General is going to challenge the bankruptcy finding by the federal judge in New York concerning Purdue Pharma and the Sacklers.
Yeah.
So they are going to go ahead with a challenge. And that possibly can translate into major money coming into Rhode Island to help support all the efforts around substance use and behavioral health. And it shows that the types of investments, for being able to have a source of funds for Narcan means that you're going to be saving people's lives rather than trying to save money.
Fascinating stuff right there.
Yeah,
critical stuff. We'll get into this. We definitely got to do a podcast on all of this. Richard Asinof, publisher of Convergence Rhode Island, here on the Seekonk Supply Hotline. Great stuff, and appreciate your time as always.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.